Tetanus is a bacterial infection, Clostridium tetani, but the actual problem is caused by the toxin elaborated by the bacterium when you are infected. Tetanus is usually contracted by people who garden or people who have an injury where there's a cut, a wound. It's important to say, however, that the injury sometimes can be so trivial that, provided a few spores of the germ gets in from some soil, that, say, a fall while playing football can even lead to it. So if you're developing symptoms, then you need early treatment. Tetanus, of course, can be much more easily prevented by a very effective vaccine that's been available for over 70 years. Tetanus is one of the few infections that we vaccinated against where herd immunity is not important. Everyone needs to be vaccinated in order to be protected. The symptoms of tetanus begin with a spasm in the muscles of the cheek called trismus. This can lead to difficulty in swallowing, pain and spasm in the neck, the shoulders, the back, and then to an extraordinary generalized spasm of the whole body where you have arching. As a consequence, muscles can tear from their tendons and bones can fracture. You may suspect that you've got tetanus if you have the muscle spasms in your cheek, in your neck, in your shoulders. But the only way you can know for sure is to see your GP, and that's critical because the GP can treat you with antibiotics, refer you to hospital for further symptomatic management. There's still a 2 to 3% death rate from tetanus. It's important to seek medical attention. The immunisation program to protect you against tetanus involves 3 doses in the first 6 months of life, another dose at preschool, and then a 5th dose when you're leaving school. Now, most people will have long-term protection from those 5 doses. Usually though, by about the age of 50, up to half of people have low antibodies and need a booster.